Good afternoon, everyone. It's Dr. Angela Cudger. I'm the founder of Legacy Holistic Health Institute, where we train and certify holistic health coaches. And today we have Dr. Philip Halstead with us, and we are going to be discussing a few different topics. So if you're with us, make sure you let us know where you are and let us that you currently do. So as you join into the conversation, let us know who you are and what it is you currently do. Today, we're going to be talking to Dr. Philip Halstead. He is a board certified holistic health coach and he is an integrative medicine doctor. Philip, how are you today?
I'm great, Angela. Thank you for having me today. I'm looking forward to this.
Awesome. So, for those of you who are not familiar with Legacy, this specific platform is to give a voice to essentially the voiceless, those individuals who are minorities in the health coaching industry, those individuals who are marginalized or a part of marginalized communities. That means LGBTQIA plus, the senior community as well. These particular populations sometimes get left out of health and wellness. And so, if you're part of those populations, or if you identify as a man, so men also get left out of health coaching sometimes. And so, this platform is to give information and allow the highlight of those individuals who are working in the field and are working in that space. All right. So, Philip, there's a lot that we're going to cover today. I want to go jump right in. The first thing I want to talk a little bit about is your journey, why you chose medicine, why you chose the medical field, and what led you down your path of health coaching.
Well, first of all, I think what led me down the medical field, or led me to the medical field, was just my interest in sciences, which developed early on in childhood, really, and just kind of blossomed from there. I think it was just kind of a natural progression, just based on my interest. Certainly, I was trained in traditional medicine back. I guess when dinosaurs walked the earth back in the 80s. It was a while ago. But through my evolution, as I went through my medical education and into my residency, and then finally into practice, one thing I noticed was that patients got well to a certain extent with conventional medicine. Symptoms were controlled, but what I noticed is that underlying conditions just tended to march on. And I just sought out a different route or something else that I could add in to what I was currently doing. And that's what led me to integrative medicine, which is basically where you integrate traditional medicine with what they call alternative medicine or complementary medicine, where you use natural remedies, natural treatments, nutrition, and so forth, and add those into the conventional treatments. And I found that once I started doing that, patients had much better outcomes. They actually got healthier quicker, and it actually helped when you undergirded them and made their cells stronger, literally feeding their cells better. It actually made the medicines that they used work better. So overall, the health outcomes were tremendous. So that was great, and that was a nice turning point there. But I think as I went on in doing integrative medicine, I noticed too that in the whole healthcare system, the way it was structured was that the patient was kind of getting lost in the shuffle. And I really felt that health coaching, by its very nature, puts the patient or client in the center of everything. And that's really what kind of got me interested in health coaching, because in addition to the integrative and natural type medicine or treatments, I could actually put the client in the center of their own healthcare and empower them that way. So that's what ultimately got me to the point where I am today.
That's amazing because I feel like some people, when they describe the healthcare system in the United States, they say that it's broken, right? And you've probably got way more years in the field than me. I was across a couple of, well, three different professions. but I was in the space for a little over 20 years. And I can say some of it's broken and some of it's not. And so I try not to jump on that bandwagon because I've been bedside, right? And so I get that it takes a team and it takes an integrative approach to actually helping people. And so you're one of the many physicians now. Integrative programs are spread across the US now. And it's really up to the, I think, practicing physician, and you could tell me if you agree with this, is it up to the practicing physician to say, integrative approach, or can they just opt out of helping people get better?
Yeah, yeah. I kind of lost you there a little bit toward the end there, Angela. The last part of what you said.
I said, is it up to the physician to determine if an integrative approach is necessary, or can they just continue down the path that they're already on?
Yeah, it's up to the physician really to choose whether or not they want to add integrative care into their regimen. I think as a physician hopefully physicians get more open-minded. It really takes a lot of open-mindedness to really start to do integrative medicine, because the traditional healthcare or conventional medicine is so ingrained in people that a lot of times it almost takes like some sort of an epiphany on the part of the doctor to really kind of open their eyes and help them to really see the importance of adding other treatment modalities into what they do. So really it's really up to the doctor and what their experience is and how much they really want to pursue adding or converting their practice to integrative medicine. It's not for everyone. Everyone doesn't do it for sure. But I think that the people that I've come across that have opted to do it have no regrets about it. They love it.
Yeah, I like that. And so we were discussing this a little bit earlier before we went live. And one of the things I said was I've never been a Black man. You know, I've been a Black woman all my life. And that's the one thing I do know how to do, right? But Black men and their health and their care is not necessarily something that I've had to deal with, their challenges and different things like that. I've been enough to be around predominantly healthy Black men, right? But I do want to talk about how important it is to take this integrative approach to the health care and as it relates to not just Black men, but all men.
Mm-hmm. Yeah, I think it's critically important because, as I said before, medicine is great. I have no problems with medicine, traditional medicine and medications. But the thing is, medications were never designed to really build anyone's health. Medications are primarily designed to deal with symptoms. And sometimes we get symptom relief and treatment and cure mixed up. They're all different things. Okay, you can feel your symptoms can get better with the medication while the disease process marches on. So unless you're really building the person up from the cellular level up, which means feeding them properly with proper nutrition, because that's what cells respond to. They respond to nutrition. They respond to nutrients. They don't respond to medications in that same way. Medications aren't building them up, but nutrition does. So this is why integrative and just taking a more holistic approach to healthcare is so important. You don't want to leave anything out. You don't want to just treat symptoms, but you want to do things that are going to help to build that person up from the cellular level. Because healthy cells make healthy tissues make healthy organs make healthy people. So the only way to really get to that root level and build everything up above it is to really make sure that the person is being fed properly, that their nutrition is right, they're doing their exercise, they're getting their water, all these sorts of things. And like I said before, even when you do all those things, not to say that the medication is not necessary, but definitely the medication will actually work better and will actually solve or control the symptoms better. And you may actually find that you end up needing lower doses or fewer medicines as you build up a person from that cellular level up. So there's no substitute, in my mind, there's no substitute for proper nutrition. You cannot get around that. Because if you give people medicine, but you don't work with their nutrition, the medicine will get them so far, but beyond that point, they're not going to be able to go any further with their health. You have to build people up to the root level.
Yeah, everything has to do with the, how the cells are fed, and at Legacy we look at everything, who they're around, what they're eating, what influences these different things. But I know that food is a part of this, but I also want the people who are watching to be educated about what social determinants of health. I know last week we spoke a little bit with Natasha Bruley, Dr. Bruley, about food deserts, since she is a personal chef and she finds it challenging, or some people find it challenging, to continue to eat the way she's teaching them to eat because they don't have access, right? And so I want to take some time just to talk a little bit about, or have you explain what social determinants of health are and how these play into us being able to get food, the right things, to that cellular level.
Precisely. That's an excellent question. Definitely, SDOH, which stands for Social Determinants of Health. There's actually some people who actually prefer the term social drivers of health, which I guess in a certain way that might be better, just because when you drive something, it means you kind of have some sort of a influence over it, where social determinants kind of makes you feel like you're locked in. So either way, either terminology is fine. But basically SDOH, what it does is it deals with the personal, social, and environmental factors that affect the person's health. So we're talking about things like economic stability, education, environment, what kind of environment a person lives in. Are they in a safe area? Does it have green spaces, or is it a high crime area, or whatever? What healthcare access does a person have? Do they have insurance? Do they have a hospital or doctor's offices in their neighborhood, or is there just nothing there? Also social interactions as well. What's their family structure like? What is their support system? Are they living alone? Do they feel isolated? Are they living in fear just because of the environment that they're in? So it's all these things from a interactive and personal point of view that can actually affect the person's health. And these things are no small matter. These are a big issue, especially for the minority population. We deal with a lot of different things on these levels, and it definitely has a profound effect on our health. Can have a profound effect.
Awesome. And then, so these are drivers. I like the change in that language, because it allows the person to reframe the ability to drive the determinant. Well, what we would call the determinant, right?
Right.
I've never heard it called that, but I love the language and the reframe, because although people live in certain environments and have different factors, in some cases it's challenging to change or shift that. And then in some instances, they do have control over it. They can take employment elsewhere. They are in a field where they can shift things and they can move their family, or they can live differently. And they may not even, in some cases, think to try. Now, when you are, even as a physician, when you are talking to people, or when you are engaging them about their care, do social determinants of health come up often when you're speaking with minorities?
Yes. And in fact, if the patient doesn't bring it up, I bring it up, or I'm coaching a client and I always ask them about it. I go down that list of social determinants that can be potentially be affecting their health. And if there are certain things that are there, I ask them, well, what have you done to try to address those, or how successful have you been in addressing those issues? And if they need help with that, we try to find some resources that can help them to better their situation. But that's very important, because you're not going to really know too much about social determinants unless you actually ask about it. Because a lot of times they won't volunteer it in a lot of cases, but sometimes you just have to specifically ask about, what's your neighborhood like? Do you have places where you can walk? Is it safe? Do you have green spaces? Do you have a doctor nearby? How far do you have to travel to get to your doctor? Do you have a healthy, supermarket in your neighborhood? How do you get your food? Where do you get your food from? So these are all kind of things that you have to really ask about. And by asking them, it actually opens up a whole new window in terms of how you can help people to improve their health. Because if they're not dealt with or asked about, and you try to do whatever treatment or program you're trying to do with that client, then that's going to kind of limit the benefit of those treatments and programs if you don't try to address those things that are impacting them on a daily basis, for probably been impacting them for years. So that's why asking about SDOH is so important.
Yeah. And what would you say in your coaching or, helping minorities, what would you say are the determinants or the drivers that almost always come up when it comes to men? Because I know, and here's why I'm going to say this, because I know that there are certain drivers that, men ignore stuff. Okay. They ignore stuff to like the last minute. And what might be a driver that affects me. So like, I might say, I require sunlight. I require green space. I have to be able to get out, get fresh air, and walk. And I found in all the places I've lived a lot of places. Let me say that. I have lived a lot of places. And I like to move. I like to see new places. I like to do new things. That's just me. And one of the things that makes these places qualify is sunlight, is the air, is the access to the elements, and then it's the food. Like it's those things too. So when you're dealing with men, right? Or from a male perspective, because you've probably been a man all your life, and when you're dealing with this, what are some of the drivers that they almost always bring up? I think it's so important for health coaches and aspiring health coaches to know that. So what are some of those drivers that you say, well, almost every man I've dealt with, or even in conversation, bring this up, and it's a driver of their health?
Well, I think certainly one thing is access to healthcare, or just following up healthcare, or establishing themselves with a physician. So many men, they don't have doctors. I think partly is because the whole macho thing, they don't want to, face any potential problems. Another thing is there may not be any doctors around that look like them. So and there's always this kind of like inherent distrust of the medical profession by minorities too. Are we being treated fairly? Are we being diagnosed properly? Are we being given the proper medications? So I think there's a barrier there. There's a barrier to healthcare. There's a barrier to seeking it out and understanding how the body works and what sort of things need to be watched, in what age time they need to be checked, and so forth. So that's definitely one barrier. Sometimes men, it's just our nature is to try to want to solve everything and try to be independent. And so sometimes a social thing becomes an issue too, where we don't have enough interaction with other people. We don't talk to other people as much. We don't open up as well. So we don't have that kind of conversations back and forth about things that affect us, or things that are bothering us. So we tend to live in isolation a little bit too much. So I think those are definitely two of the main things that I see a lot of among minority men, is just having proper health care and associations with other men, just just social interactions that is so very vital, very vital.
Yeah, I agree. And I think that like Leslie was saying, representation matters. It's so important. And it's more than just what do you call it? Racial representation. I think it's also gender representation, right? And so one of the things that, I think is important is I know we have a lot of, women naturally gravitate to the medical field. They naturally gravitate to the healing arts. They naturally gravitate to things that let them nurture and help other people. And health coaching is no different from that. It's kind of the way women are typically wired, I think. But in this space, we have women who help men, and I think, or, we may have some aspiring health coaches who might want to help elderly men, or they want to help men that have been a part of the military, or yourself. Thank you for your service. I want to talk a little bit about some attributes that the aspiring non-male, possibly non-minority health coach must have, some attributes they must have to be able to help those populations of people where there is some underrepresentation. What kind of characteristics you think they should have?
Well, I think for one thing, they have to be very open-minded. They have to understand that the if they're coaching a minority client, that person, that minority client's life experiences may be vastly different from theirs. So you need to be open-minded to the fact that what affects their client, maybe they may be looking at life in a totally different way than the non-minority coach does. Okay, so in that sense, as long as they're aware of that and they address that, and I think that can help them to be very, very effective. I think the problem comes is when the non-minority health coach feels that the minority client's life experiences is exactly theirs, the same as theirs, and things affect them the same way. They don't. Okay, they definitely don't. And that can be difficult. I mean, if you don't actually have experience with being a minority in this country, sometimes it's hard to be able to relate to that. But I think if you just have the mind frame that yes, their experience is different, and I need to learn about it. I need to ask them about what their experience is like, and they go into it with an open mind. I think they can be effective with coaching minority clients. But they have to have that open mindedness. They have to understand that their life experience is different from their clients in a lot of ways.
Yeah.
As long as they're aware of that, I think that would help.
Yeah. And then I think too, I like that. And I think too, it's important for them to, this is where that coach approach is so important. We have individuals from varying backgrounds that come into health coaching, and some of them feel like it's just easier to tell a person what to do. And that won't fly with the minority man. I can tell you that now. That's not something that they will typically respond to. And that might not be something that works across cultures too, not just with Black men, but I think men in general, and so it's important, I think, as health coaches, that they are open, but they're also listening and they're paying attention to what's not being said, what they're not telling them, and kind of know those signs. Some of that, I think, and you can speak to this, I guess, is, when men shut down or when they don't want to speak about something. Some of that is just universal with the male population. It has nothing to do with being a minority male at all. It could just be that they're male and they don't want to talk about that thing at that time. And so coaching is very social, very conversational. And I think any skilled coach also needs to be able to do that. What do you think?
I agree. I think obviously one thing we always adhere to as coaches is that the client is always the center of everything. So we want to try to find out from the client what actually makes them tick. And if we can kind of ask the right questions in the right way, then hopefully they'll open up. Because you got to remember, a lot of times clients will think of coaching similar to regular medicine, where the doctor's just going to dictate to them what to do and so forth. But coaching is a totally different animal. It really puts the client at the center, and the client calls the shots. Yeah. And that could take some time for them to get used to. Anybody, minority or non-minority, to get used to that whole different framework. But I think by and large, once they get used to it, they start to appreciate it. So that actually can kind of hopefully help these men who have hard time opening up, if we just let them know that we're there for them. It's not that we're there to try to usher them into something, but we're there for them to find out what it is that they want to be ushered into in terms of their health. And I think that that's something new for them, and that actually will help to hopefully break down some of those barriers and kind of get them to talk more. If we just kind of get to the point where it's all about you, it's not about me, it's about you as a client, and what we can do to help, and what you think you want to pursue in terms of getting that help, and then we can pursue that. So sometimes it's getting them. Sometimes that closeness is because of a lack of feeling that they have, a feeling they don't have control, and that they're out of control. So, or they feel disempowered. So sometimes men close down because of that. But if you can get them to open up and understand that they're the center of everything, sometimes that becomes empowering to them, and they tend to open up. And over time, they open up more and more. And they start to realize things about themselves that they probably never even thought of or dealt with, just because they never verbalized it. You know, sometimes they verbalize things and it sounds like somebody else talking. It doesn't sound like they're talking, but just getting ideas out that they have never even thought about.
Always where people go to get their power back. They go to be listened to. They go to be understood. They go to be heard, right? And so, right. You know, this is so important. Before we switch gears, I do want to say, you guys, today we will be announcing the scholarship recipient, and you must be present to win. If you can, make sure you share this out if you are watching, so that other individuals who have registered, that they can see this somewhere and jump on here just in case their name is called. I do want to announce the first recipient, or the initial recipient. And here's the way this works, you guys. And me and Philip are going to jump back into it in just a moment. But here's the way this works. Even if the name is called, you still must qualify. You still must have a call with me to determine what you're actually going to do in the field. And then the full scholarship goes to that recipient. If for some reason that recipient is present, or if for some reason that recipient does not qualify, another name will be drawn the following week on our next live stream. In the comments, let me know that you understand that. If you are here and you're watching, let me know that you understand that. And those are the rules. Those rules have gone out on email so many times, but let me know, say, I understand in the comments. Let me know that you understand that. And Philip, you and I are going to switch a little bit to value-based care, because we say that, you know, health coaching is where people go to get power back. But I want people to understand what that power looks like in terms of value. And so we hear this term value-based care kind of being thrown around. So I want us to kind of shift gears a little bit there. But first, we're going to announce our scholarship recipient. So the scholarship recipient, congratulations to Miss Linnea Spillane. If you are present, Linnea, say present and accounted for. I think I saw you on here. Not sure if you're still here, but congratulations. And for those of you who are also here, congratulate Linnea on her full scholarship. We would have to do a call to make sure that you understand how the scholarship actually works. And this is a full scholarship to the class that starts tonight. Hi, Linnea, you are still present. Hey. Congratulations. All right. So there's a bonus for everyone else who sticks around at till the end of this presentation. And so we're going to talk a little bit about value-based care. So we understand that health coaches are supposed to listen to the person, understand the person, and those different things. But I kind of want to, if you could, Philip, help the audience understand what value-based care is and how or why that's so important in the medical field now.
Yeah, that's another great question, Angela. Value-based care actually started back in 2006. There was a shift from fee-for-service care, which was more of a quantitative type approach where the number of tests you did determined the amount of money a practitioner would make or a hospital would make. And in 2006, the whole thing shifted. It shifted from the fee-for-service to value-based care, which was a qualitative framework. Okay, qualitative care or value-based care, in a sense, what the provisions of it were to provide extraordinarily good patient experience, to advance health equity. And equity is different from equality. Equality gives everybody the same thing, but it may not be enough for everyone. When you have equity, if you need, I always use the analogy of three people standing at a fence. You got a tall person, a middle height person, and a short person. The tall person, and none of them can see over the fence. The tall person may only need one box to see over the fence. The middle height person might need two boxes. The short person might need three. So health equity, what it will do is provide the tall guy with one box, the medium height guy with two boxes, and the short guy with three boxes. Equality would just give everybody one box. So it'd help the tall guy, but the other two would be left out. So value-based care is designed to give everybody all the boxes that they need to be able to stand over and see over the fence and get the health care that they need. Also, it was designed to improve patient outcomes, make sure that they're getting the health care that they need and getting the results from their health care that they deserve. Also, trying to do all this at reasonable cost, because with the fee-for-service, healthcare costs were escalating and going up and up. But there needed to be a way to maximize health outcomes, but minimize the cost as much as possible. And also, value-based care was also important, concerned with the healthcare workforce as well, and just trying to make sure that their well-being was maintained. So the whole shift to qualitative care and the quality of care that people were getting characterizes value-based care. Just trying to get more value, better care at lower costs for everybody concerned. So that's the whole idea behind value-based care.
Good. And how do you think health coaches, why do you think they need to be aware of value-based care and health equity, especially if they're dealing with minority populations?
Because that's basically what we deal with as coaches. We're trying to make sure that our clients get what they need. And as we said before, the client is quality of care. It's the quality of care that client gets. And the client has to be the center of everything. The focus has to be on that client. And we want to make sure that they're getting what they need based on what it is that they have, what their values are, what they value for their health, what they value in their lives, and what they want in terms of their health. So I think it works perfectly with health coaching because it's qualitative in terms of instead of quantitative. So just the quality of care, we're trying to improve the quality of people's lives, and that's what value-based care is, and that's what health coaching is as well. So it fits in perfectly with it.
Yeah, and I've heard people, and let me know what you think about this. I've heard people, I've seen people post, and I've kind of heard people talk about this a little bit too, that health coaches, value-based care is plenteous. You guys, if you haven't seen, if you don't follow like healthcare articles and healthcare news, they've been trying to shift to value-based care a long time now. And this is also one of the reasons why health coaching is so important, and it's so important to become a health coach. Um, but let's talk a little bit, Philip, about people say, well, health coaches do provide value-based care, but they are still the most underutilized allied health professional, right? So can we talk a little bit about what allied health professionals are? I know you probably know. Not, I know. I've been one for a long time. But like what are they? Because that's the classification. I just kind of fell into these allied health professions over the years. Think I've, I think every single license I've ever held was as an allied health professional, which is a good thing, I think. But can you explain, as a physician, can you explain to the audience what is allied health, and then talk a little bit about whether or not seeing that health coaches are the most underutilized allied health professionals available now?
Yeah, I mean, in my mind, an allied health professional is someone who basically is other than a doctor or a nurse, but they provide a care, a health, certain level of health care for people, but they don't have necessarily that level or that nature of training. So they fill kind of gaps that the doctors and nurses can't do. Okay, they can't. We doctors and nurses can't do everything. So the allied health professionals are very, very important because they do, the other things that we as doctors and nurses need, like radiology techs. We need X-rays to see to check on our patients, but we can't just run off and do X-rays on everybody. We don't have the time to do it. So the allied health professionals are very, very valuable and very important. We couldn't do our jobs without them. So they're kind of like the behind the stage and behind the scenes people that kind of do all of the ancillary testing and extra care that we just as doctors and nurses don't necessarily have time to do. Certainly, health coaching definitely falls into that category. I think part of the issue with health coaching is that it's so new, and so many people don't know exactly what it is. I think the word is getting out better now as time goes on. It's just a time thing. I mean, the more time goes on, the more people are going to recognize and understand what health coaches are. But what we want to do is start to get people to understand that we're not trying to usurp anybody's authority. We're not trying to usurp the doctor's authority or the nurse's authority. We're there to help them. We're there as a help to fill in a gap, a very important gap, because doctors have only so much time to spend with patients and so much time to really delve into what makes them tick or what it is that they want, what they value, what they want with health goals and that sort of thing. And that's the perfect spot where health coaches fit in. We have the time to do it. That's what we're designed to do. And, clients love it because they're getting a whole different taste of their own care with a coach that they cannot necessarily get with their doctor. The doctor serves a specific purpose that's very important, but the health coach kind of fills in. We serve as kind of a bridge between the client's health and what they get at the doctor's office. So health coaching by its very nature is only going to grow because of that, because this is what people are looking for now. Most changes in healthcare in particular are client driven. They're patient driven, they're people driven. When people demand something, it's up to the system to provide that. So once people get more of a taste of health coaching, what it is, they're going to demand more of it because they're going to see the value in it. They're going to see how empowering it is for the client and just the better health outcomes that they can get and achieve from it. So so definitely health coaching is I'll consider it to be definitely an allied health field.
Yeah, and I love it. I love that they're classified as an ally because, again, sometimes when people have to work kind of and you've probably seen this if you've ever, and some of you guys watching, if you've ever done med surg, if you've ever done bedside care in any kind of fashion, you see how people are territorial concerning their duties and the things that and rightly so, because their license is responsible for it. but we come in peace, right? We are allies to what has to be done for the patient or the client, and that's the important part. If you're thinking about becoming a health coach, sometimes I think, you know, when people decide to become a health coach, it's because it's out of anger for the current system, and the reality is that that system's not going away. So we must find a way to be allies with that system instead of trying to uproot it or be against it, or, you know, this is the way that you create sustainable change, not just for the system, but for the people who need it. Now, I'm gonna, because you touched on like people, what people's needs and things are. I want to talk a little bit about post pandemic and some things that you may have encountered and how you help your community through these kinds of things. Have you encountered people, or have you noticed that their need for personalized attention post pandemic has gone up? Have you noticed that? Or do you think
Um,
people are always needy? I feel like people are always needy, but I feel like after the pandemic, everybody wants attention. Like when we got back outside, like I feel like everybody wanted attention. But have you noticed that people want specific attention and things customized to them?
yeah, I mean, I think that that's always been the case, that people do want things customized to what their needs are. Probably has gone up a little bit since post pandemic, because I think a lot of people during the pandemic kind of lost that. They kind of lost their way in terms of feeling like they, you know, their needs were being met just because of the isolation part of it. So I think that the coaching is very important, because when you have something, when you offer something that's client centered, and that client has been potentially isolated for a while and not, you know, because of the pandemic situation, that makes it even more welcoming for the client, because some things may have built up within that person during the pandemic that they need to kind of get through and get out. So I think with this, the client-centered approach to coaching, that's the perfect place to for them to kind of express what those needs are and have them worked with in conjunction with a health coach. So I think that, yeah, I mean, I think that the needs were always there. May have upticked a little bit during the pandemic, but you
Mhm.
know, coaching fills that gap in perfectly, I think.
Yeah, I agree. I agree. And then, so another question, another thing I want us to touch on is sustainable well-being. And I think one of the hallmarks of a great coach is getting the client to have sustainable well-being at some point, something that they can continue on their own, and something that they need less and less support for, that they're empowered enough to then do on their own. I want to kind of talk a little bit about sustainable well-being as it relates to men in particular, right? Because I want us to try to give more information. I don't think we got another man coming on here, so I got to get all the information that I could possibly get, right? So I want to talk a little bit about some of the, when men fall off, like the barriers, like some of the things that we know are going to get in the way. And because I think this is going to inform the people who are thinking about becoming health coaches, or the people who are health coaches already in how to deal with the male population and getting them to have more sustainable well-being. Now, I think I can say this from a female perspective, and I think everybody's a little bit different. But from a female perspective, we just kind of dig in and get it done, right? It's like one day you're a mother, one day you're not a mother, and the next you are. Like you're taking a baby home. It's got to be fed. It's got to be clothed. So I think something just snaps for women, and they can
Mhm.
sustain things, if that makes sense. They can just kick into it and sustain things, right? And
Yes.
so, what are, and men might be the same way, but I'm not a man, but what are some of the barriers to that stick to itiveness, that sustainability that you've encountered from men?
Well, I think for one thing, I think probably the biggest thing for men that gets in the way of sustainable health changes is life. Because just having to be a lot of times just being the breadwinner and having a lot of responsibilities. Sometimes those things circumvent, and sometimes we tend to put ourselves on the back burner, and kind of put everything else ahead of us. And I think sometimes we lose sight of our own health. But we have to understand, and whenever I talk to men in groups all the time. A lot of times like church groups and things like that. And the first thing I tell them before I even talk to them about specifics about disease states or anything else is I tell them that they are important. They are vitally important to their families, to their communities, and their health is paramount. It is absolutely paramount. And they are not to lose focus on taking care of themselves, because there's so many people that depend on them to be healthy. And I think sometimes men lose track of that. They lose sight of that, just as how important they are and how needed they are. And, just with, we talked about social determinants of health. Those things can get in the way. Even systemic determinants of health, like racism, those sorts of things can get in the way. Distrust of medical systems can get in the way. So we have all these things kind of floating around in our heads that are kind of fighting against us. But we have to change our mindset. I always try to get men to make sure they kind of try to change their mindset and understand that what they do for themselves now is so vitally important for what they're going to feel like 20 years from now. And you want to be around. I mean, I always ask men what they value. And straight across the board, they almost all say, value my family. I want to see my kids grow up. I want to see my grandkids. I said, well, if you want to get to that point, you've got to take care of yourself. Okay. You don't want to just live. You want to thrive. You don't want to just survive. You want to be healthy. So when you can kind of link what their goals are with what it is that they want to do with their health, sometimes that helps to drive them and motivate them to go ahead and do those things, do those health things, and help them to stay on track. They have to understand and remember why it is that they exercise, why it is that they eat right, why, what's the purpose of that. As long as they don't lose sight of that and they can continue to remember that, I think that's a good way to eliminate or try to minimize those barriers of sustainable health. And that's really what we as coaches are really just helping them to do. We might have them in a 6-month program, but this thing is not supposed to last 6 months. It's supposed to last a lifetime. The 6 months period is just to get their habits to change. But they have to understand that this is something that they need to continue on for a lifetime. In order to get the benefits of it for a lifetime, they have to continue it and sustain it for a lifetime. It's not something you do for 6 months or a year and then forget about, because you'll just end up right back where you were before you started coaching. You had the same problems there. So I think just linking their values to their health goals and just reiterating how important they are in society, regardless of what outside influences say about them, those things are not to be believed. Those things are set there specifically to derail us as men. And we have to understand that and overcome that. And once we kind of pull the cover off of that and see it for what it is, I think we're able to beat that back.
Yeah, I agree. I love that. I love that. It's so important, I think, to understand what barriers could possibly come up when coaching men. And some people that are probably watching are thinking through how their fathers react. I know I was, how my father reacted, right? When my mother would say, hey, you're important too. You got to take care of this as well as you age, because we have grandkids, we have children, people who we've got to see on a regular basis. And he was always so locked into just getting through the day, right? And it's more than that. You're right. They've got to thrive. Now, you guys, if you have questions for Dr. Halstead, please put those questions in the comments now. I usually wait to the last minute to ask that, but if you guys can put the questions in the comments now, we'll start going through some of those. The last thing that I want to touch on, because this is also a platform for what I think is called for marginalized populations. And I personally feel like it is not just, a lot of people look at marginalized populations as, you know, LGBTQIA, but I feel like they're veterans. I feel like they are people who are in the senior population. There are a lot of different people who feel a certain way when it's time to ask for help. And I love the population. I feel like their experience, no matter what branch of military they've served in, is unique and it's always unique to them. And I'd love to talk a little bit about what are some of the things that they might face. And I know you're a veteran, if you could share a little bit about that as well. You also have done quite a bit of so if you could touch on a little bit of that as well, that would be great. And just some of the things that we might need to be aware of. And veterans aren't just men, they're women too. And so I think it's important to, as a health coach, be able to speak to that population as well.
Yeah, I mean, I think veterans are a unique population, right? They've had experiences that most other people have never had, particularly the veterans who've had wartime experiences. Okay, they have to deal with a lot of things like post-traumatic stress disorder and environmental toxins that they may have been exposed to. Lots of different issues they have. The suicide rate among veterans is very, very high. Okay, because of that emotional component to it. So way higher than the general population. So those sorts of things we have to take into consideration. If you coach a client or deal a client that was a veteran, you want to make sure you have those things in the back of your mind, because that can really have a big influence and impact on how it is that you coach that particular client. You know, some clients, some veterans, if you were to say integrate, you know, mindfulness and different exercises, visualizations, they may not be able to tolerate things like that. You know, a person who doesn't have that the military experience may be able to do it just fine, but you got to remember that sometimes these veterans who've had issues, particularly with post-traumatic stress, if they close their eyes to do something, it's terrifying for them. So that's just a kind of a basic example, but you definitely want to make sure that you take those things into consideration. But coaching plays a vital role for veterans, because they need to be able to voice what it is that they value and how it relates to what it is that they care about in their health. And they need that extra help sometimes, because, like I said, their life experience may be totally, you know, pretty much different from somebody who wasn't in the military. You have to make those adjustments. You have to make those inclusions when you coach a veteran, and just be aware that their life experience is something that you may not ever be able to even imagine. Some of the things that they saw, particularly in wartime. I mean, you can watch it on TV and read books and see movies about it all you want, but unless you actually experience those horrors firsthand, it's hard to even imagine what it is. So you just have to have that level of sensitivity and that level of awareness if you're coaching someone who's had either a veteran who's had traumatic experiences, or even somebody who hasn't even been in the military who has also had traumatic experiences. You have to be careful with that. But we also have to be careful too that we don't coach outside of our scope of practice too. If we have a client that we feel needs to have some specific kind of psychiatric care, we have to never hesitate to make sure that they get that care that they need. Because sometimes they may not be coaching candidates right off the bat. They may have some other issues that need to be worked through first before they can come back to us as coaches. So we have to be careful with that. We can never diagnose anything or treat anything. That's not what we do. So we have to leave that to the specialists to take care of that. But, you know, once those issues kind of get under control, and we feel they're better candidates for coaching, then we can bring them back into the fold. But we have to be careful, be mindful of that as well.
Awesome. I love that. I love that. I think we have one question. I'm going to put it here in just a moment, but I agree. I think that one of the things I learned was that there's trauma in every room. There's, if you're out networking, if you're, wherever you are, you might encounter someone who's had some kind of trauma. And so I think carrying, I guess, this sense of humility about it, and knowing that it might be present is why we approach and talk to people like we got some sense, right? Or we approach and we speak to people in a way that is mannerable, understanding, and inclusive, like you said. It just signifies that, and that other people are here, and our experiences are just different, because we just all have different lives,
Right.
And I think that's very important. So Leslie asks, how do we get more minority males into health coaching as clients and as coaches? That's a good question. That's a good question.
Very good question. I think exposure information is important, because so many minority males don't even know that coaching exists, and don't know what it entails. So I think that that's a large part of it. And same thing goes with getting more clients too. It's all about exposure, doing as much as we can to get the word out that this is an option, and then how it can help men. Because like I said, men like to have as their healthcare professionals people that look like them, not only minorities, but also men as well. So if we can work to get more coaches in, understanding that the whole goal of getting more coaches is to help with the healthcare of minorities in the healthcare community. Then I think we can start to see hopefully an uptick in getting more minority males into the picture, and getting more minority men to come in as clients to get the help that they need. But it's all about, I think, just exposure and telling people and teaching people what coaches are, and what the role is that they play, and how they can actually help someone get to the health level that they want to get to. And a lot of times we explain what we do, people in them, minority men in their minds, that clicks, because it says, it clicks. It says, that's exactly what I'm looking for. I'm looking for somebody who can keep me on track, that can help me with my health goals. I got a list of health goals long, but I need help, guidance on how to get there. So again, just knowing that option is there for men is just the biggest part. Just knowing, because there's just so many people that just don't know it is there.
Yeah, I agree. And I always tell people, if they're like, well, what do health coaches do? I say, well, it's a gentle cross between mental health and behavioral change and nutrition, right? I say it's a good cross, it's a good mix between those two, without heavily being either one of those, right? So there's quite a bit of behavioral change. Health coaches do a lot with mindset, and then they do a lot with food, what we eat, how we access those things, and how our overall life becomes sustainably well. All right. So before Leslie says, thank you. Tamika Miller says, as a male, do you believe that men are able to focus on their health when the information is coming from a female? Ooh, that's a good question. Asking because the ego can be kind of tough. Tell me about it, Ms. Miller. So what do you say, Dr. Halstead?
Yeah, Tamika, that could be a tough one. I think it depends on which female you're talking about. I mean, I think if you're talking about a wife, sometimes that can be a real big issue. my wife's been trying to get me to do things for years, and ultimately I cave and do it, and it works. So I'm like, I kick myself for not doing it sooner. But yeah, I mean, men have to kind of park their egos at the door, when it comes to their health, especially. And anybody who can give sound medical advice, they need to be able to take that and absorb it and take it for the fact for what it is, meaning that it's something there designed to help them. It's not something there to condemn them or ridicule them or belittle them. It's something there that's designed to help them. And attitude is everything. Okay, attitude, mindset. So yeah, it can be tough to get that. Talk about my friend. Okay. Mindset can be tough, but it can be done. It just has to be done in the right way. Just this, if a female talks to a male about their health, just let them know that their health is a major concern of theirs. They're not trying to bully you or coerce you into anything, but just to have you be around for a long time, and ultimately that should be your goal. You want to see your kids, your grandkids, and all that sort of thing. It's very important. So we just have to learn to park our egos at the door, basically.
Yeah, it can be like that coaching some women as well, but she's, I can see where she's coming from, having to make it the focus. But I agree as well, Dr. Halstead, it's about the approach, and approach is so big in health coaching. It's so big. Before we say goodbye, before we do that, there is one more bonus. We are giving out one more full scholarship. That scholarship recipient's name that was drawn will be Miss Sandella Malloy. So Sandella, if you are present on this live stream, let us know that you are here. And everyone else, congratulate Sandella and Miss Linnea. So Sandella and Linnea, please make sure that you send a message, and I'm going to put that message. Oh, great. So Sandella, you are here. Excellent. And so I want you guys to send, shoot that text. I want you, if you're the recipient, to text scholarship winner to this number. And then I'll know that we need to do a call, because you still have to qualify through me to determine what you're going to actually do with that. And we will go from there. So both individuals were present, and that call needs to be today because class starts tonight. All right. And once we speak and talk about everything, you guys should be good to go to join us in class this evening. Philip, thank you so much for your time. Those of you who are also interested in a partial scholarship, you can text the word enroll to the number you see on your screen. You can still get in this evening as well. Philip, take us out of here. Give us some last encouraging words. This has been amazing. I always enjoy these conversations. I've had people say, man, I learned more on that live stream about health coaching than I've ever learned. And so I know this was value packed, and I know a lot of people got information that they hadn't been aware of prior to attending this live stream. And so give us one final note when it comes to interacting with Black men, something that we know we should remember, and then we'll get out of here.
Well, just remember, and I thank you, Angela, for this time to present. But just to remember that men are very vital. They're important. We need to do what we can do to get more health activities or more health knowledge to them and encourage them. I think once that knowledge is available, the encouragement is there, then men will take it, they will accept it, and they'll run with it. Okay. But I think we need to just be mindful and just be always on the lookout, always be trying to do that for our men. And they'll appreciate it once they know it's there.
Mhm. Awesome, awesome. Well, you guys, this has been amazing. And again, Philip, thank you so much for your time. Listen, we'll see you guys
Very well.
again next week where we sit down with Miss Leslie Atley, who's also present here today. All right, Philip, thank you again for your time. You guys have a great day.
Bye bye.